Hey, Dr. Birchler, Chiro Health Spine and Disc Center. This video is going to talk about how often or how frequently somebody should be adjusted in chiropractic. And behind that question, of course, could be 1,000 different scenarios, and part of the answer is it's not the same for everybody, but I'm going to give you a few principles to operate by that you might find yourself somewhere in this spectrum. So here's a couple principles. One is that when somebody is in pain, they're in bad shape, and we see a lot of that. Data shows that the higher the frequency of adjustments, the better results or clinical outcomes that person gets. So the way I would say that is, like, if I was hurting bad, I would want to be seen like every day until I'm functioning better. Like every single day, I would want to get better quickly. If I'm doing something on the spine that's the right thing to do, it's going to help. I want to do it as much as I can until I'm functioning better. Right. So a higher frequency of visits for somebody who's in bad shape, who needs help, who has a serious condition, is going to be better. Okay. The other thing that is very significant is that it takes time for body tissue to heal. You're not a machine. You're a living being. And so behind that pain inside the body, there is tissue, ligaments, muscles, tendons, discs, all of that kind of thing. And those things take time to repair. And so the tissue healing time is important. You want to be seeing a person or adjusted with some regularity through the time it takes that tissue to repair. Things like discs and ligaments take longer than things like muscles to get better. It has to do with blood supply to the tissue and how they repair and those kind of things. All right. Now, in terms of, let's say somebody is in pretty good shape and they're wanting to just maintain their health or use chiropractic to improve their performance, improve their well-being, keep things from getting worse over time. For several decades now, it's been known that for a joint that is misaligned and has pressure on it, and a joint that can't move properly, that joint will start to wear out if it can't move right. And anything where the joint is immobilized for more than, say, a week leads to somewhat rapid or irreversible changes in the cartilage. At the beginning, they may be microscopic, but over time, you can see those, on X-ray, bone spurs and thinning of cartilage and those kind of things. So the principle there would be that somebody could get adjusted once a week or so to areas where there's wear and tear on the spine to minimize the chance of that worsening or wearing out over time. Can't keep people young forever, but you can do it. You can do a lot, and you want to do whatever you can to maintain or keep those things from worsening. So that would be on the frequent end of kind of maintenance care. Now, there is data from studies of people who have, say, chronic back pain, and then they go to chiropractors and they improve. Their function gets better, mobility gets better, pain gets better, all those kind of things. And then data shows that if those people who have underlying conditions that will never be normal, meaning there's some wear and tear or something that is there, it's not going to, it's not like they're young and it heals up and it's good. It's like there is some permanency to the underlying problem. If those people get adjusted even twice a month, they tend to maintain well or possibly even improve a bit over time after an initial course of, say, 3 months of care where they may be seen 2 to 3 days a week or that kind of thing. So the information there is that if you've had trouble and you improve with care, that doing something a couple times a month would be a proven, effective way to maintain your function, your benefit, possibly continue to improve at an even higher level than you have with, say, a few months of care or a few weeks of care. So hopefully that's helpful to somebody out there. I guess that another scenario that I didn't mention, but comes up somewhat commonly is people who they understand a lot of the benefits of chiropractic. They like to get adjusted. Maybe they want to have their kids get adjusted, or maybe they're in generally good health and they're just looking to be at their best. A lot of those people I generally recommend do something once a month. It's a very traditional chiropractic type of care schedule, but it's often enough to make a difference. But it's doable for people and really helps them be at their best. And that's something that maybe not a lot of formal research on, but it's one of those pragmatic things that anybody who's been in practice for a long time knows that people tend to do well. They tend to stay in communication frequently enough that as stuff comes up there, they're kind of heading it off and maybe don't end up in a bad position that they would if they weren't in that frequent contact with the provider. So there's a lot of things behind that, but for pragmatic purposes, say kids growing, playing sports, get that kid adjusted once a month. But if they're playing football and they're getting tackled every week, get them adjusted once a week, because you're gonna, their body's having more trauma and that kind of thing. So there's a range of principles there, and hopefully you can identify where you fall in that and use some of this information to just help kind of refine your own frequency of chiropractic care, so you get the best results and stay well.